Hello, everyone, and welcome. My name is PMFA. I am owner of Artisan's Palette, and I'm also owner of the online blog site called IamACleanEater.com. I am joined by the wonderful Dr. Alisha. She's here. Thank you. And we are doing part two to a series that we started last month on menopause. So if you haven't seen that, please go to the IamACleanEater.com website and you can subscribe to our YouTube channel. And the video is all available on YouTube. So we had such a fun time talking last time that unbelievably it got to almost 1 hour. So we were like, oh my gosh, we have to do part two. So part two to this is bioidentical hormones. Okay, and so we have some notes here and we're going to go through. Now, if you guys have questions, please leave them, post them for us, and then we'll be able to answer whatever questions are coming up live. And that's true. We've got a feed going on here. We're live on your feed, right? Which is through the Dr. Alisha feed on your Facebook, right? So we're doing two live feeds, one on Artisan's Palette and one on your site. Okay, let's get started. We have a big topic, bioidentical hormones. So let's first say, what is that? What does that mean?
So let's break down the root word.
Yes.
Bio, our body.
Okay.
Identical, matching what's inside our body. So hormones that are matching what is inside our body are bioidentical hormones.
Okay, so that's the simple answer, right?
Yep.
So when we go into that, and then I don't think we're gonna.
And let me.
Yes.
Sorry.
Go ahead.
So that, I guess, is the concept of what it is. Hello, everybody. Thanks for watching us. So when we speak of the word bioidentical hormones, the hormones that we are referring to are estrogen, progesterone, and testosterone.
Okay. Just write that down so we know testosterone is an extra one. And this isn't just, bioidenticals just isn't, they're just not for females, right? They're also for males.
They are. And
right?
I already thought of our part 3, perhaps.
Okay.
Today I'm mainly going to want to go into the estrogen and the progesterone.
Okay.
And I thought, depending on how the interest is, maybe we'd even have one for more geared towards men.
Okay.
That'd be a shorter.
But women also need the testosterone.
They do.
Right?
So women need all 3 hormones, and men sometimes also need all 3 hormones.
Yes. Okay. So I think it's worth talking about, and I do think there might be a part 3 coming.
Yeah.
Yes. Okay, good. So now we understand just understanding the word bioidentical. Very good. But can you use, or the term bioidentical in the field, is it used also for pharmaceutical?
It is.
Okay.
So, we often think that bioidentical hormones are only used by maybe alternative doctors, natural doctors, but the truth is there are some mainstream, regular Western MD doctors who are using bioidentical hormones. A common one, you may know somebody who's using an estrogen patch.
Okay.
That patch is bioidentical. It is still big pharma.
Okay. So big pharma, we can also assume that it means synthetic. Is that accurate?
No.
Okay, tell me.
So when I say the word big pharma, so if we're talking about prescription bioidentical hormones, you can get those from 2 places.
Okay.
You could go to your local compounding pharmacy, which a compounding pharmacy is just a pharmacist who has chosen to go back to a time where we more, how do I want to say this? Handcraft / customize.
Yeah. I think that's a good way to put it. Customize for the person, right? Rather than just buy something that's kind of off the shelf.
Yes, mass produced.
Yes, exactly.
And that could probably even go into your industrialized food analogy.
Right.
So when I say big pharma, big pharma can produce synthetic, but they also produce some bioidentical.
Okay.
However, where the tricky part is that when something is mass produced, there's often binders, fillers, ingredients that I don't like for my patients.
Okay.
So I want to take one thing of progesterone.
Okay.
So some symptoms of low progesterone for a woman might be that their periods are very heavy. They're seeing clotting in your menstrual cycles.
That's low progesterone.
Low.
Okay.
Maybe they are getting migraine headaches. Maybe they suffer from anxiety or insomnia.
Okay.
The list could probably go lower, but let's just kind of start with those are the really main symptoms. So when I hear those, I'm thinking, this person might be low in progesterone. Well, I could write a prescription where they could go to their local drugstore pharmacy to get progesterone in an oral capsule.
Okay.
It is bioidentical.
Okay.
However, it has peanut oil in it.
Okay.
And I even think there's some food coloring in there.
Okay.
Peanuts are a common allergen.
Sure.
And they can actually be a source of something else, aflatoxin. We won't get into that.
Aflatoxin and its high mycotoxins. Yes.
Thank you.
Yes.
So do I want big pharma oral progesterone? No. I do have one patient, though, cost prohibitive. So for it to be made by the compounding pharmacy, it is more expensive. Because it's hand batched likely versus the mass produced drugstore version of oral progesterone.
Okay, so let's just step back 1 second, because today we're talking about bioidenticals, but we started off the conversation last month with regards to menopause. Yep. So when we now are jumping forward to bioidenticals and we're saying, okay, this doesn't just apply to women that are in menopause, or does it? What's your opinion on that?
So I have a fair amount of patients who are perimenopause, so their periods are changing, but they haven't quite finished their cycle. That's a time where sometimes we use bioidentical hormones. But even the word bioidentical hormones could even go to your premenopausal, women in their even as early as 20s.
Because they're having these symptoms, right? Low, because you're like, oh, she has heavy periods and she's getting migraine headaches. She might need some help getting more progesterone. So then you could start them off in bioidenticals earlier. But generally, this is a time frame for women anywhere between, would you say, 35 to 65?
I would say that would be a pretty fair assessment. And in my practice, I'm even going to say on average, I'd say it's your 40s and your 50s.
Okay.
It does extrapolate to those ends. And I did use the example of like the oral progesterone.
Yeah.
But you might be familiar with the over-the-counter version of the topical progesterone, which is bioidentical, so matching the progesterone inside your body. But it's at a low dose, so therefore it's available over the counter.
Right. Okay, so let's also talk about some of the items here that it is. I know we want to talk about how it's made because we're trying to understand, okay, there's this term called bioidentical. You can get something in an oral form, in a gel form, in a patch form. It could be progesterone, it could be estrogen.
What did you just say?
Progesterone.
That's a great distinguishment.
Okay.
So you probably got that term from the medical community.
Okay.
Because most doctors, they are prescribing progestins.
Okay.
That is the synthetic version trying to mimic what we have in our body, progesterone.
Okay.
So really important, ladies. I have a question. Can hormones that are off cause PVCs, preventricular contractions? Yes. Yes, they can. I have seen that.
Maybe explain what that is. Not to go off topic too much from where we're at right now, but
so generally abnormal heartbeats.
Okay.
I don't want to go on that tangent, but I just wanted to catch that person real quick. So progestins are the ones that are associated with cancer.
Okay.
So there was
the synthetic ones.
Yes.
Okay.
There was a big health trial, the Women's Health Initiative, I think back in 2002, where they put women on progestins,
Okay.
had to take them off, had to stop the study because of adverse effects such as cancer.
Breast cancer and ovarian cancer, those
Yes.
two specifically, and uterine?
Yes.
Okay. So maybe those three in particular. And since we're on that, because I actually didn't know that. I thought I was saying progesterone, but I guess it didn't come off that way. So I didn't know that that was the name of the synthetic one. But what about, is estradiol, is that the name of it? And is that a synthetic version of estrogen?
Estradiol is, we have estradiol. It is bioidentical.
Okay.
And again, made by Big Pharma,
Okay.
as well as made by the compounding pharmacy.
Okay.
And that can come in a patch form. It can also come, mainly we use a different form called estriol in the vaginal suppository.
Okay.
Here's a fun tidbit, ladies. For those of you suffering from vaginal dryness and urinary incontinence.
Okay.
A lot of stuff. What is incontinence? It's that you essentially you're peeing your pants on accident, whether that's from like squats or jumping. We call that stress incontinence, meaning there's stress and impact on the body, or I laugh too hard and I lose.
Sneeze.
Yep. So that's stress incontinence. And then as well as urge incontinence, where, oh my gosh, I gotta go and I'm gonna have an accident. Estriol.
Okay.
We're going to get a little bit scientific here, just for a second.
Okay.
3 forms of estrogen in our body.
Okay.
And it's, think of the numbers, 1, 2, and 3.
Okay.
Estrone.
Okay.
O-N-E.
Okay.
The first.
Write those down.
Okay. The first estrogen. This is the one that is more harmful to us, that we do not want a lot of, because it is more associated with risks. Estradiol. 2, and then estriol, E3.
Okay.
When I'm prescribing bioidentical estrogen for hot flashes, for bone issues, for sometimes even, that can go into low libido, lots of different things. I'm generally giving a combination of what we call bi-est, which is E2.
Okay.
The estradiol.
Estradiol.
And estriol.
And E3.
And E3. It's an E2, E3 combination.
Okay. So that's why it's important to come to somebody like you, because you're running some tests, you're being able to see, and then you would say, I want more estradiol and estriol, and I'm going to make a formula for you, and then they go to a compounding pharmacy, and that's the basically saying that's for me specifically, right? Rather than just getting something over the counter or taking a patch. Or is that how these come? Like if you were to do that and you go to a compounding pharmacy, is that how this would look? It would look like a patch, or what would it?
So to be honest with you, I don't use patches. Patches are mainly produced by Big Pharma. Okay. I'm sure the compounding pharmacy does do patches, but generally we're doing estrogen in my practice and in many other natural integrative practices, transdermally with a cream. Okay. So just a simple cream.
That they would put in soft areas, like it's better to put here, because you're going here, so it's good to put here, maybe behind your back.
Behind the knees.
Behind the knees, okay.
So we're looking for thin skin areas.
Okay. Okay, so those would be the 2 main areas.
Yeah, sometimes we say lower abdomen as well.
Okay. And is this something that they would apply every day?
Generally.
Okay.
Sometimes we want to cycle. So just depending on their status of premenopausal, postmenopausal, different theories. For my postmenopausal women, I might say, yes, do this every day. For my perimenopausal, we may want to have an off time.
Okay. So the process would be, the kind of workflow that I'm understanding is basically we come to you and say, okay, I am getting migraine headaches. I have, having problems sleeping, and here's my age group. And then you're saying, and I have vaginal dryness. So then I need to make something custom that has progesterone, okay, and estrogen, E2, E3, whatever. Yeah. And then you would take that all into account, and then that comes into that person takes that to a compounding pharmacy. They get a cream, and then that cream gets applied every day. That's
Correct.
kind of the process.
Yes.
Right? Okay.
Yep.
So now if they're not doing that process and going to somebody like you and then a compounding pharmacy, they would go to a medical doctor.
Yep.
Right? Obviously, you're
Yes.
also a naturopath, but they would go to Western medicine, go to a medical doctor, and then they might prescribe what they're calling bioidentical, but then the problem is there would be some not great ingredients in the bioidentical that could come from a medical doctor. Is that accurate?
Yes, and that's
Okay.
mainly with the progesterone.
Okay.
The patch, I haven't looked up the ingredients in the patch, but I want to say the patch is decently, like, it's effective and pretty clean, I want to say.
The estrogen patch.
Correct.
The estrogen patch that's coming from a medical doctor that's not specific for you, but that's going to be a little bit cleaner than what would be in progesterone. Accurate?
Well, and we're talking about two different hormones.
Yes.
So I would say that for some people that would be a totally fine option.
But from a medical doctor, would they be able to say, oh, I'm going to give you both progesterone and estrogen, and it's going to come in this form?
So that's a great question.
Okay.
So mainly it is believed that if a woman still has her ovaries and uterus, estrogen, we know, is proliferative. That means that the estrogen can help tissue grow. You know, when we get estrogen, we form breasts.
Okay.
The uterine lining gets thicker. So in the woman who still has all of her body parts, hasn't had a hysterectomy, we generally say, okay, we need to give progesterone to counterbalance the proliferative effects of estrogen.
Okay.
However, if the woman had a hysterectomy, doesn't have any of her female parts again, mainstream medical community probably would say you don't need progesterone for those hot flashes, those night sweats. You're fine with estrogen. Okay. And so they only really give progesterone generally in the case of they're trying to just kind of counterbalance the effects.
Okay.
I think that might be something that's missing in the medical community of their understanding of maybe not like a subtle progesterone deficiency. So often I imagine this teeter-totter with patients. And so generally we have more progesterone relative to estrogen.
Okay.
And if I switch the teeter-totter and now I have more estrogen relative to progesterone, I may not have a progesterone deficiency, but the medical community may not kind of recognize that and to see the other needs of progesterone aside from just saving your uterus and your ovaries.
Right.
Does that make sense?
It does. Wouldn't there be more back and forth and trial and error if you're going through and just taking one that would be either progesterone or estrogen from the mainstream medical community, and then saying, well, we're just going to, since you don't have your female parts, we're just going to put you on estrogen because you don't need progesterone. And then somebody could be, well, I still have these symptoms. It doesn't feel like it's so focused.
Yeah.
Or specific.
Yeah, I would agree.
So wouldn't that woman be going back and forth and saying, oh, well, how do I increase this? Or is she's just kind of on her own in that case? Or just making more appointments?
I'm going to say that's probably those women that leave kind of mainstream allopathic because their needs aren't being met. And often what I hear is I was recommended an antidepressant.
Oh, yes.
Especially when we're looking at those progesterone symptoms, kind of mood issues. So sometimes they're just like, you know what, let's just give you
another drug.
Yes.
Okay, got it. All right. So moving right along, again, if you guys have questions, please drop them here. We would love to hear from you. So one of the questions is, and we might have covered some of this, I think, in a little bit of it, but how is the bioidentical made? So we've talked about that it could be in a gel or a patch or, taking something orally, but what would be in it? And let's just talk about the ones that just specific, like
so progesterone,
your workflow.
Progesterone is generally made from wild yam.
Okay.
And And then estrogen can also be derived from soy.
Okay.
And good question. Now that I'm thinking, I'm kind of assuming that those are GMO free, obviously.
Well, not all the time, right?
Yeah.
So that's the problem. So I was just about to go there with you. So all the estrogen that you would recommend, whether it would be E1, E2, E3, based on what we talked about before, the component or the original source would be some soy form.
Generally speaking,
okay.
Yep.
And so now as a woman, we generally hear, oh my God, you don't want to take soy. Soy is like the worst thing on the planet. If you take soy, it has to be fermented. So why now do we want soy?
So that's a great question.
Okay, and let me just preface it with, we still don't ever want GMO soy. Okay, so however this goes, we do not want GMO soy, period. Okay, so go ahead.
So, and I meant to call the compounding pharmacist to be like, what else is in this? And I didn't have a chance to make that phone call. Okay. So generally speaking,
so part 3, we'll come back to you on that one.
Maybe we'll throw that in with the part 3. So with with estrogen, we want to look at why we're giving it. Mm-hmm. So often it is hot flashes, night sweats, other reasons. Those are some of the big reasons why. Low libido. And so what we have found is that when we do replace them, these symptoms go away. I'm going to kind of segue risk factors. So I did a poll on Facebook to say, and I think you participated, thanks, to say like, hey guys, what do you think? Do you think bioidenticals are safe, harmful, or does it depend on the person? And the truth be told is that it does depend on the person.
Yeah.
So let's pretend Jane has had breast cancer. She is not a good candidate for taking bioidentical hormones, even though she, may be wanting them, needing them, because we know generally those female cancers, not all of them, but they're sometimes estrogen positive, progesterone, or both. So the risk profile of hormones is essentially that of drinking. Let me kind of preface this. We know that alcohol is a precursor to breast cancer. So ladies, if you're drinking, I see a lot of patients and they often are like, I like a glass of wine or two at night while I'm making dinner to relax. It's, it's my me time. And more often I'm trying to get them to change that because we know that alcohol is a risk factor for breast cancer. So what is safe alcohol use? It's delineated as 1 drink, what is 1 drink? I believe it is
4 ounces, right?
I think 5 ounces of, maybe it's 4 of wine.
Okay.
And then is it 1 ounce of a hard alcohol and maybe 12 ounces if it's beer. I looked that up and I forgot to write it down. So 2 drinks is too much. So women are allowed 1 drink, which, the clarified drink of what that is. It's not this. Per day, on average, men get 2. That's the safe allotment of alcohol. So when I'm prescribing
4 now, which could change because that's the problem with everything, right? That's what they're saying is safe now, right?
Yeah. Good preface. So when I'm giving hormones, I say, okay, I've just now increased this risk. Actually, this is new because I just kind of got some continuing education a few weeks ago. So longtime patients probably haven't heard this. New ones, or when we revisit prescriptions, because that does need to happen every year. You should be reevaluating, if not sooner. Do I still need this? So then with this prescription of bioidentical hormones, we are increasing that risk as if you were drinking 2 alcoholic beverages.
I see.
So it's a small risk, but nonetheless still a risk. But we have to weigh, everything.
Manage it.
Yeah.
It's a risk management at that point. Okay. So if estrogen now that comes into the bioidentical is from soy, and then we'll say, okay, let's hope it's non-GMO soy and organic. I hope, okay. Now, what if somebody says, "Oh, I just go to Costco and I get non-GMO soy milk and I have 8 ounces a day"?
Yeah,
What's that answer?
Well, the answer for am I getting more estrogen from that?
Am I getting more estrogen? Is it safe to do that? Is that a way for me to counter that I don't have to take the bioidenticals because I'm just going to increase my soy intake?
Yeah. So I want to say that the compounding pharmacy probably does a couple other things to it, and we have one here locally in town.
Yep.
So many communities you have a compounding pharmacy, and I just need to go revisit them, and I'm sure they would walk me through their facility and let me watch them make it again.
Yeah. I think it's important to know what's in it, because if we're saying that oh my God, don't do this from the medical community and it's all synthetic and some of the other stuff, you know, I mean, if they have peanut oil and progesterone, the GMO soy is as bad or worse than the peanut oil that's in the progesterone. So we would have to clarify that, right?
Yep.
Okay, so good. But the wild yam, generally, yam's not one of the 10 crops that's GMO'd, so we know it's not going to be there. And then it says wild yam, which is generally above organic. So that would be, just by the term wild yam, seems like it would be a clean alternative.
Yeah.
Okay. So, and I think we just covered that. That was our next question. How does it compare to synthetic? I think we're good on the progesterone, how it compares to synthetic, but we'd have to confirm on the estrogen. Yep. And then when we talk about testosterone, we'll have more information on that.
Yes, and I do see a gentleman has joined us, so thank you, Joshua. If you're wondering about testosterone, stay tuned. We hope to have additional show. Let me actually just say one thing about testosterone.
Mm-hmm. Is women need it too.
They do. And with the topic of testosterone, that there can be cottonseed oil, which cotton is a highly genetically modified crop.
Mm-hmm.
So in the conventional testosterone world, that can be in there. And one thing that we're also leaving out, this would just be too detailed, is other ingredients. So often I'm trying to tell my patients, stay away from parabens.
Mm-hmm.
Be careful with these other ingredients that often can make up creams and facial self-care products.
Mm-hmm.
And so we need to be careful about these too. And that's another kind of cool thing with compounding, is that we can avoid some of these things.
Mm-hmm.
So really with the testosterone, there's some still precautions with genetic modification as well.
Yes, I totally agree. So we have another question here, and actually I'm getting to this question. Is there long-term bad side effects of bioidentical hormones? Cheryl, thank you for the question. And I was getting to this, and now's a good time to do it, because I think that one way we should talk about this is understanding that it's like, this is the first time in history in the past, 60 plus years, that the medical community, both traditional and, naturopath, are making suggestions that women should be given some form of hormones on a daily basis,
Mm-hmm.
right? Which has never happened in our lifetime before. So I think that segues nicely into this question from Cheryl is number one, is that safe? Do we think it's safe that it's like, well, we're taking this because we have these side effects from come on, Western medicine made up the whole thing. Menopause is just put a label on it. So is it safe to do this? And are there bad side effects from this?
So that's a great question. Just today, my last patient, she is new to me. She's been on bioidenticals for 15 years.
Okay, wow.
She's age 64.
Okay.
And I'm now taking over her prescription. And I said, have you gone off of your hormones?
Mm-hmm.
And seen how you feel?
Mm-hmm.
And she said yes, and I feel like my mood is definitely different. And so Is it safe? I would say, I've only been in practice 8 years.
Okay.
So there is some limitations to say, yes, I brought one of my kind of continuing education binders, the Academy for, the A4M Academy for Aging Medicine. No, I'm blanking on that. So I think it's something that, yes, when used safely, it can be safe long term. And so I wouldn't say that it is certain that there's bad side effects, but I think that every year we need to assess, is there still a need?
For sure. And I think that that's probably part of what I'm getting at is think of women specifically, think about this on your own to say, this is the first time in your history, in just health, right?
Yeah.
Because it's like the first time that a community is suggesting that you take hormones every day.
And,
for a prolonged period.
And I think that I don't want to diverge on a too long of a topic, but I think that our lifestyle has changed so much.
Mm-hmm.
So that has put us in a position of being hormonally imbalanced.
That's true.
And so,
and environmentally, all of the things that are putting our hormones out of balance.
Yeah.
For sure.
So,
that's a good point. So it's like, well, we need some help. I've talked to a lot of my customers that are on some form of hormone therapy, bioidenticals, whatever it is. And they tell me, they go, Pia, I would not be able to talk to you right now. I was, and you feel for them because it's like they have it really bad.
Yeah.
And so one in particular, she was telling me, she said it took her years to dial in specifically that's why this compounding is so important, right?
Yeah.
She went back and forth with her doctor, and she said, finally, I have found something that works for me. And she said, and I feel great. I have the energy. I can do all of this stuff, But I agree with what you were saying is every year, I think the women should sit themselves down and say, is this something that I should continue to do?
Yeah.
Yeah.
And, we have another question. Is it safe to conceive and carry a baby to term on bioidentical hormones? So, I would say the hormone that is needed, so let's talk about progesterone.
Mm-hmm.
Progest, helping gestation.
Oh, yeah, okay.
So progesterone helps us conceive. So if you are deficient in progesterone, OBGYNs do prescribe progesterone suppositories early in pregnancy for some women so that they do not miscarry.
Okay.
So that would be safe. And generally we don't have premenstrual, generally speaking, as a general rule, I don't have premenstrual women on estrogen, so they wouldn't even be in a conception phase of their life. Generally I'm using estrogen postmenopausally.
Yeah. Do you mean pre-menopause or?
Yes.
What do you mean?
Well, the person was asking about conceiving, having a baby, and about bioidentical hormones. So I'm like, if you're wanting to have a baby, you probably don't need estrogen.
Right.
Bioidentical hormone-wise.
So if it's progesterone that is for the part of gestation, and progesterone's mostly made from wild yam, would it help this person to increase their wild yam consumption? Like just from food?
I don't think that our bodies, I don't think it can, I remember this, I don't think our bodies do convert it. I think when it's synthesized and kind of processed into the cream, it then is more bioavailable for our body to use. I don't know if going through the GI tract, we get those same effects.
The same results. Mm-hmm. Okay. So we have another question here. What about women that never had any menopausal symptoms? They might be coming, Elena. No hot flashes, no sweats at night. What would be the benefits and why? Well, first of all, praise the Lord that you're not having any of these effects.
So here's my theory. I think Elena has good adrenal glands.
Okay.
Because when the ovaries retire, the adrenal glands which are back here on top of the kidneys, they help us secrete estrogen, progesterone, and testosterone.
Oh, good.
So my theory is, you know, the work we need to be doing now together is having us all have good adrenal glands. Which, not to segue too much, but that whole environmental change.
Yeah.
Our adrenal glands, we now live in a world where we're 24 access, you know, it's like, I sent you a message on what platform,
Yes.
you know?
Yeah.
And now we have so much demand on us. And I think we're going to be seeing that EMFs,
magnetic fields. Oh yeah.
I think we should do it. I think we should do maybe another class on that, because I think we're going to see that is like what smoking was. So back before,
a contributing factor to all of this, right?
Well, and I think back when they said, you know, they used to believe that smoking was okay.
Oh, yeah.
Like way back in the day.
Oh, sure. Actually, not that far back in the 60s, doctors were recommending it to women. Oh, just it'll help you lose weight. Start smoking, right? That's not that long ago. It's in the 60s, even in the 70s.
Yeah. And now we know that smoking causes cancer. So I think we're going to start to see electromagnetic fields have that same.
Especially now with 5G coming out and with a tower everywhere. But that is for sure a different topic. 100%.
Yeah, sorry to judge. So anyway, so what would be the benefits and why? Well, hormones do have a ton of benefits. So let me just kind of rattle off a little bit. And I'm just going to, so I don't want to take too much time. So I'm going to generalize all hormones.
Okay.
I'm not going to specify them out, but generally these are helping our brain, our bone density. They even have effects on our cardiovascular system. They also have effects on our mood, our libido. And so does that mean that you need to take them? I personally would not say that. So I don't know, Elena, if you're really a great candidate. I will say I am also conservative. So some other doctors might be like, let's just save your bone density. Let's just protect you.
Yeah.
Where I am definitely on the more conservative side to say, you know what? I know plenty of, for lack of a better term, I'm going to say old ladies who seem just fine.
Yeah.
And they were healthy and had good bones and good brains, and they didn't take hormones and they were fine. So I think it's a case by case basis.
Excellent. And excellent questions. Thank you, everyone. Do you use bioidenticals for Hashimoto's and or Graves' disease?
So those are two, Hashimoto's and Graves' disease are two thyroid autoimmune conditions. You know, there's a big overlap with, you know, we are talking about the endocrine system. The thyroid being part of the endocrine system, and then our ovaries and our hormones, adrenal glands being part of the endocrine system. Generally, I do see these, even though our body is all intertwined. I don't necessarily, when I'm dealing with Hashimoto's or Graves' disease, I'm not necessarily thinking that this person needs bioidentical hormones.
I agree with that too, yeah.
I've got a question over here. It's a slippery slope and hard to diagnose. I get labs every 6 to 9 months, and there are usually changes. Age, activity, everything affects these. If I don't take the estrogen, I can really tell. Got to find the right person.
I think that's more commentary.
Yeah, that is true. You know, something that I don't think I addressed on our template list was, how do we test? That's also an area of controversy. So generally, I always start with a blood test. The reason being is that it's covered by insurance and I can get a good idea. However, technically, when we now put that woman on bioidentical hormones, if I continue using serum, I may or may not see fluctuations. Some are advocates for salivary testing. The reason being is that in the saliva, we can capture the free hormone. And free hormone is really what is available for our body to go and do work at the different receptor sites that I already mentioned, the bone, the brain, the cardiovascular. So for testing, there's there's blood.
Salivary. Yep, blood.
salivary. Some practitioners are using urinary.
Mm-hmm.
I've done a little bit of urinary testing, and I think it has some cool benefits, but when you're looking in data and in the literature, I don't think that there's a ton of research behind urinary hormone testing. So, Katie, that comment was, Kathy, that comment was really for you, that, if you're having a hard time pinpointing, maybe you need to look at different testing ways.
Yeah.
So that's when I'm like, you know what, maybe we need to spend money on the salivary testing if the blood isn't corresponding with what the patient is saying. Anyways, that is really the key.
Yeah.
So we need to match what is the person saying? What are those symptoms?
Mm-hmm.
Pair that with the labs. Don't just treat the lab,
Right.
treat the person in front of you.
Right. Excellent advice. Okay, we're going to come up to closing up here. I think we talked a little bit about this already.
Yep.
And I just wanted to bring up, we talked about the bioidenticals and the different forms in which we can apply them, but there are also options for pellets.
Yeah, good point.
Where does that fit into this whole structure, and how does it, and if you want to voice your opinion on it?
Yes. One public announcement, never take estrogen orally. So that does have a risk profile of deep vein thrombosis.
Okay.
So that's kind of just a caveat that just came to mind. So estrogen, you always want that topically.
Okay.
In the form of a patch or a cream. So when it comes to pellets, generally they're using testosterone as a pellet. Sometimes I don't do pellets. So caveat is that I am not well informed in this modality. There are people in town who have practices, I think, all about pelleting. I have a handful of patients who have had pellets. They loved it at first. And then when they go back, they aren't getting the right amount.
Okay.
So if a medicine is being injected in you, there's no going back. Right. You can't take that injection out. And so for that reason, I don't feel that the precision is there to kind of guide how much to give. Okay. And so especially when it comes to testosterone, when you get overdosed in testosterone, which is a common pellet therapy, it's acne. It can be increased hair growth and, places you as females don't want hair growth.
Anger.
And yeah.
A lot of anger.
And aggression.
Yeah. Right. But you made a good point here that, and I wasn't aware of that pellets are usually for testosterone. So you wouldn't take a pellet if you needed progesterone or estrogen.
Generally speaking,
okay.
To my knowledge, I want to say that one of my patients said that maybe she did get a progesterone pellet prior. So don't quote me on that, guys, but mainly I hear about it for testosterone. And it's expensive.
Where does the pellet go?
It goes somewhere in the glute. And I think it's just right underneath the skin. I think it's a minor
slow,
supposed to probably be like a
aggressive through 30 days. So it's like
3 months.
It's 3 months. Mm-hmm. And then at the end of the 3 months, they go again.
Yeah.
And if let's say somebody does that for testosterone, that's fine. There's other ways because we're going to talk about testosterone. But what about when we talked back about the estrogen and the progesterone? You said it's always better to put it here or behind the knees. But is that
so often women who have come into my practice who have already had pellet therapy, they are coming in with those additional creams.
Okay.
Or oral pills often.
Okay.
So generally estrogen is not pelleted to my knowledge.
Okay. Very good. All right, let's check our board here and let's make sure we're not missing anybody's questions.
Yeah.
I think we've got a good handle on it. If you have any last minute questions, please add them now because we're going to close up here. I think this was a wonderful conversation.
Yes.
Once again, thank you so much.
Thank
really
you.
Learned a lot. It was wonderful. And so I think we're doing it's the fourth Tuesday or third, excuse me. It's the third Tuesday of every month. So we're going to be back here in July on the third Tuesday. And I think we do have enough for part 3.
Okay,
right,
yeah,
for
we'll
this
kind of
series.
focus on testosterone.
Yeah,
I think that'll be fun.
I think so too. So with that said, please go and follow Dr. Alisha. She's tagged here in the post. So
and likewise, guys, follow Artisan's
Palette and come and see me in the store.
Yes, I was just speaking about you because this patient was asking about meat.
Okay.
Do you carry red meat here?
We do. We have it in the freezer here, and our partner is Primal Pastures.
Yes, that's what I was telling her.
Yes, and
perfect.
That is our local source for true pasture-raised meat.
Yes.
And the definition of pasture is that the animal is outside on pasture eating their diet. It's 2 levels above organic. They're eating their diet, and then the farmer is responsible in doing regenerative farming, so they are turning the land. Okay, so it is much better for the environment, much better for the animal. Basically, eating that meat is going to be far more healthy than eating either organic meat or industrial meat.
Yeah.
Okay, so pasture is 2 levels above organic. And no, you cannot get pasture-raised meat at the supermarket. The highest level of food that you can get at the supermarket is industrial organic. If you have questions on that, please drop them. I will be having a course called Get Food Smart, Join My Tribe. It will be available very, very shortly. Yay. And so when you see that, definitely sign up for it. It teaches you all about these different levels and deceptive marketing.
Awesome. I can't wait. All right, guys, thank you so much. And until next time.
Yes, we're going to close off on this one. So thank you, Dr. Alisha, and we're going to close off on mine. So once again, please join me in the store or online at iamacleaneater.com. Sign up and subscribe to our YouTube channel. And until next month with Dr. Alisha, we will see you. Thanks, everybody. Bye-bye.
Thank you.